are essentially reversing some of the aging process. And that was off topic a little bit, talking about urination when I was talking about bones and joints. But so what I do is I combine for the appropriate treatment of an individual these kinds of substances. So we have extremely effective ways of getting nutrition into the body and having it work in the body. The one I'm mentioning from Germany uses what's called the nutrient transport concept to direct that into the body, and very effectively. There is another kind that are isotonics, and actually the German company is going to be coming out with an isotonic form of some of their stuff. But there's isotonics from Nutrimetrics that I use as well. And isotonics, if you want to look at this, you can go to our website, which is www.aptw.net, short for A Path to Wellness. Okay, so aptw.net. Then you go to RX Nutrition, click on that, and then you'll see on the screen there's a link to Nutrimetrics. Then you can click on that link and go into that environment. Now, if you are one of my patients, we set you up an account, and there are discounts available for you. If you are not one of my patients, then certainly if you become one, then we can make that available to you. But otherwise, if you want to go take a look at these, you just go to aptw.net, then you go to RX Nutrition, click on the Nutrimetrics link, and you'll see the vast variety of nutritional medicines, really, or nutraceuticals, as opposed to just over-the-counter nutrition, that effectively get into your body and work very quickly. And, you know, I'm a strong proponent of these because I see the difference every day. Every day I see, you know, people who insist on trying over-the-counter nutritional supplements. They can match them in quantity, like if you're talking vitamin D and you're taking 5,000 IU a day of vitamin D in the over-the-counter form versus 5,000 IU of vitamin D a day in the isotonic form. There's no comparison. The quickness, the rapidness of increasing the level of vitamin D in the body is frankly amazing. So using isotonics, which I'll describe the concept of that. Okay, so isotonics, what that means is that they're at the same pressure as body fluid. Okay, so when you combine this powder and make it into a liquid and drink it with water, you know, combining the right amount of water with the right amount of powder, because it has to be done correctly, then drink that. That then is seen by the stomach sensors as being a body fluid. So seen as body fluid, it's allowed right through the stomach and through the bottom sphincter into the intestinal tract. And then from there, it goes right into the bloodstream. It's absorbed right through the intestines into the bloodstream. The intestinal membranes are rather thin, so it's very quick absorption. And it really literally takes 5 minutes. This is well studied and documented. 5 minutes for this nutritional, these nutraceuticals to get into the bloodstream. Isotonics are often used in hospitals and other environments, particularly because of their effectiveness and speed. So as opposed to, say, somebody who would otherwise have an IV, isotonics can be used to get the same substance in there very quickly, while this same format can be used for nutrition. And, you know, there have been articles here and there about people wasting their money on nutritional substances, right? Nutritional supplements. To a certain extent, I tend to agree with that, only in that when they are buying them in the form of a pill is not amenable to full absorption. Therefore, the majority of those supplements, you're getting about maybe 10 to 30% effectively into your body, which means that you're wasting essentially 70% or more of your money because you're not getting what you're paying for. You're only getting a fraction of it. So that's the dollars and cents of it, but also it's not effective. So what I strive for and aim for with the way I do this medicine is I look for the most effective means of bringing a person back around on their levels. This can be for anemia. This can be for vitamin D deficiency, otherwise known as hypovitaminosis D. This can be for B12 deficiency or a folate deficiency if somebody wants to be pregnant. These are very important issues. So I'm finding the most effective way to get that in and get those numbers up as quickly as possible. All right. Now, in the case of anemia, quite often the answer from conventional medicine is to send them to the hospital for a transfusion to get the iron levels up. That's not necessarily the way to do it. And then on the other end of the scale, you have hemochromatosis, which is basically an excess of iron. That still can be treated nutritionally because there are nutritional substances that help to reduce the iron levels in the blood as well. So by taking the right kind of combination, those levels can be reduced. Again, the trip to the hospital is not necessary, in my opinion, okay, based on my practice. And so again, I guess I better go ahead with the disclaimer that, you know, this show is not meant to treat, cure, or prevent disease. We're not trying to tell everybody what to do or prescribe, but I'm telling you from my clinical experience, this is the way things work for what I use, and they work very well. And so there are some very practical ways of doing what is known as orthomolecular medicine, or the treatment of disorders using nutrition, and actually targeting the underlying cause, the actual issues that are existing within the body that are part of the reason for, if not the entire reason for, a disorder in an individual. Like, for example, with women who are very fatigued, especially around their period, that's quite often related to anemia. Fatigue in a more general way can be related to a vitamin D deficiency, also to a B12 deficiency. There are lots of other issues that can be involved, but the majority of these issues that I'm talking about can be treated using effective mechanisms of nutrition. So nutritional supplementation in the right form can have not only an anti-aging effect, but almost to the extent of reversal of aging, not just almost, but actually tending to reverse at least a lot of the symptoms of aging. So, you know, when we relate to bones and joints and the issues that come along with that, certainly there are ways of dealing with that with supplements that, like glucosamine, chondroitin, MSM, hyaluronic acid, those kinds of things. But typically what you're getting over the counter, again, is not as effective, and you're not getting nearly as much transported into your body and in the right places in your body as could be done using mechanisms that are more bioavailable, which means the nutrient transport concept or isotonics, these kinds of things that get in very effectively, and also some forms of other kinds of liquids. And certainly there are also some anti-aging herbal medicines that can be used to help with the telomere issue and so on. So there are a lot of approaches, and there are isotonic forms of bone and joint formulas that can be used to help some of these issues. So again, I'll give you the site. So if you go to www.aptw.net, and then that's short for Path to Wellness, you go there, you go to RX Nutrition, click on that, and then click on the Nutrimetrics link. That takes you to an environment where you can see some of these, and if you like, you can go on there and purchase some of them. So these are very helpful in fighting the effects of aging. There are herbal substances, as I mentioned, that I use in my practice as well, that help with the anti-aging scenario. And